Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and this is the second of a two-part series on compliance and how to motivate and encourage our patients to follow their instructions, particularly regarding medication. You may remember from the first video that I mentioned that there were over 125,000 deaths annually as a result of poor compliance. So let's talk about some of the technology that is available in helping our patients remember to take their medication as instructed. There are smart vials that have timers in them, and some of them even have speakers reminding patients to take their medication properly. There are pill packs by Amazon that patients can easily contact pillpack.com, and they can receive discounts, automatic referrals, and receiving their medications in tiny little packets that they are to take multiple times a day or daily. PillPack involves the doctor of the patient, minimal or no paperwork, communicates with the pharmacy that paperwork has been received, and importantly, it provides automatic refills, so there are no delays in their medication. Walgreens is getting in on the helping patients regarding compliance and making sure they refill their medications. And there is an app produced by Walgreens that the patient can download their barcode and get automatic refills and reminders to take their medication. Alexa is now in on the compliance scene, and they are your Alexa home communicator is allowed to book appointments, refill requests for medications, and medication reminders. Alexa is getting involved in healthcare in a big way. It is now HIPAA compliant, and they can now receive and transmit protected health information. My Alexa was talking to me right there. Alexa is able to answer questions. This is in the future regarding the patient's blood sugar, where to go for instant care, and helping the patient track their refills. As urologists, we are aware of using one pill for multiple medications. We have used this for years with an alpha blocker and 5-alpha reductase inhibitors. And now this is going to be used in the future for cardiovascular medications, for one pill that will provide blood thinners, aspirin, statin, and antihypertensive medications. This will result in personalized medication where one pill will be able to supply the patient with multiple drugs. The patient will wear a sensor providing glucose levels, respiratory rate, also blood pressure, and as a result, this can be information is fed to the healthcare provider who can make adjustments in the medication, and this adjustments in the medication can now be created individually for each patient with a 3D printer in the patient's home. This is technology is here, and it's soon going to be available widespread, and going to be in the patient's home. The take-home message on personalized medication is that the dosing is going to be based on each patient's data, and hopefully this will enhance compliance and outcomes. So let's pretend how this might work. Let's say we have a 65-year-old male with enlarged prostate, symptomatic BPH, erectile dysfunction, a normal digital rectal exam, and a PSA that was normal in the past year. Patient has a history of hypertension, high cholesterol, and his medications include the alpha blocker, a statin, Viagra, and an antihypertensive medication. The patient has an app for monitoring his blood pressure and his flow rate. He can complete an online health questionnaire and an AUA symptom score diary online. He is then sent to a laboratory for his blood work. There were no changes, let's say, in his AUA symptom score, his PSA, cholesterol, and flow rate since his last visit with the doctor. The doctor can refill the medications online, and the patient receives a daily reminder to take his medication on his Apple Watch. This is a sample of the app for the voiding diary, and this is an example from the IU Flow app to measure the flow rate on an app that is done by sound on the patient's toilet. This can result easily in a level 3 visit if it's done through telemedicine. The doctor can review the records and take a 5-minute telemedicine call. It's paid for by insurance, and it results in happy patient, improvement in productivity in the office with a happy staff, and ultimately a happy urologist. So the take-home message is that good medicine does not always require a face-to-face interaction with the patient and for the doctor to examine and put his hands on the patient. So in conclusion, the medicines we prescribe do not work unless they're used properly. Failure to comply with the doctor's instructions can cause disease progression, and it has a significant impact on morbidity and even mortality. We can use education and technology to improve compliance. Compliance is a big deal, and we're all responsible to improve compliance, and we can, as urologists, make a dent in that 125,000 deaths per year. If that doesn't work, there is always a medication available called Fuck It All. This is a compliance pill. I have used it myself and recommended it to patients. And if you would like to know where it is available, you can easily contact me at my email address, and I'll be happy to see that you get an ample supply. Thank you.